that this illustrates. Number one is cost. I could go out and get those services a la carte that I got in the emergency room for probably $500, definitely under $1,000.
Yeah, like an IV, like you can go anywhere. You can go, to any
call and they'll come to your home.
Facility in a major city, yeah, and they hook you up to the IV, and it's a few $100. Have a nice day.
Exactly. So cost is one problem. Transparency is another. If they had told me the upfront cost, I would have said, no, thank you. I'll go home and drink water, or I will actually go and get those services a la carte. But I didn't get the cost until a month later when it was too late. Yet another problem is the high deductible health plan that I have that many Americans are being pushed towards. If I'd had this in December when I paid into my HSA, it wouldn't have been an issue. But I had it in January when I didn't have money in the HSA, so it's $5,000 out of pocket. We need more transparency. We need to fix the system because it's not going to bankrupt me, but it's bankrupting millions and millions of Americans to have the system the way it is.
Steyerwalt and I were looking at this earlier today, and we're shocked to see this. $220 billion right now in the U.S. as it relates to medical debt. And if you have medical debt, look at that number there. 78%, basically 8 in 10, Dr. Adams, their medical debt is more than $10,000 in a country where many Americans don't have, $500 or so of savings, disposable savings.
Well, exactly. I tweeted about this because I try to be real and help people understand that even someone with my knowledge and at my income level is struggling. And the tweet is 2 million impressions and growing because Americans resonate with this. They're frustrated. And I hope Congress will take action again on cost, on transparency, and on, again, addressing this fact that people can be hit with a surprise bill and these high deductible health plans earlier.
So you were in the Trump administration for the majority of it. Started September of the first year and stayed to the end. I remember, Doctor, before you got there, the big debate among Republicans, the very first thing Donald Trump tried to do, this was his campaign promise, was to repeal and replace Obamacare, and that didn't happen. I know you're calling on Congress to do something about it, but do you feel that your former boss should make this a bigger part of his platform going forward?
Well, I feel that whoever is president should make this a bigger part. It's hurting Americans. And at the end of the day, the president can make it a priority, but Congress ultimately has to act. And it's what I talk about a lot actually in my book. It's what crippled us during our COVID response in many ways. Folks didn't have access to what they needed in order to be safe, and that includes affordable health care that actually works.
You mentioned COVID. Big news today. Headline from The Hill. CDC ending 5-day COVID isolation guidance. The Center for Disease Control and Prevention no longer recommending Americans stay home from work or school for 5 days after testing positive. A major shift in policy as the country has moved on, much of it from the height of the pandemic. When you saw, I'm sure you knew that this was coming, but I wonder if you believe that it's finally time and that the CDC did the right thing.
Well, I've talked to folks at the CDC. They're between a rock and a hard place. Some people want them to stick 100% to the science, and the science says that COVID is still with us, it's still transmissible, but it also tells us that people aren't being hospitalized and aren't dying as much from COVID. At the other extreme, people want the CDC to give practical guidance. Bacon is bad for you. If the CDC said don't eat bacon, they'd completely be closed down by Congress and they'd be laughed away by folks. So they're trying to thread this needle between what are people actually going to do. They're not testing anymore.
I think most Americans would have wanted this many, many months ago.
Well, it took a long time because there are individuals who are still being hurt. And I talk about the health equity aspects. Long COVID is now becoming more and more aware of a problem. And this doesn't address long COVID. There are people who are under-vaccinated. There are people who don't have access to Paxlovid. And so we want to make sure we're not forgetting about those individuals, even as we transition to what many people see as a post-pandemic era.
Dr. Jerome Adams, we got to leave it there. Have you paid the bill, by the way?
I haven't paid it yet. I'm still fighting it. And,
okay.
Americans should know that you can contest your bill.
I don't blame you for doing it. Dr. Jerome Adams, thanks for being with us here on The Hill. Appreciate the time.
Hey, thanks. Check out the book.
Yep. All right. Meantime. Thank you for watching, and make sure you go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.